Welcome to Winners Wellness Center. I'm excited that you're here and excited to help you with your health concerns. Let's talk about what to expect on your first visit. Now, you're going to get some paperwork that's fairly complex, 4 or 5 pages. It's very detailed. We ask a lot of questions about hormonal balance, about immune strength, about detoxification efficiency, and questions related to your nervous system. There's a whole purpose behind that. So even if you're coming for musculoskeletal issues, we want to see how those other factors interrelate, because they may be the factor that's keeping you from getting the best results possible. So many of our patients have seen multiple practitioners and haven't gotten results, and so it's our job to help you get results. And so the paperwork is quite detailed, and that process, hormones, immune, detoxification, and neurological, stands for hidden. And I have a registered trademark on helping you find the hidden problems of your health. Now, we want to look at, also if you have radiology or labs, we want to get those reports in, and my staff will help you get those so that we can compare those with your health history. Then you'll be doing a heart rate variability exam. It's very painless. You sit there with a couple of small clamps on your wrist. It measures the timing between the beats of your heart. That tells us about your autonomic nervous system that's controlling your blood vessels, your organs, and your glands. And that tells us if your gas pedal is on too much, meaning sympathetic dominance, fight or flight, or your rest, digest, and repair system needs to engage more, that's the parasympathetic. So great information from that. Next, I'll be getting your history, a detailed history, and we'll compare that and ask targeted questions based off of what is on your exam sheet or your history form. Then I will do an exam. It's going to look different than most exams you've seen, and sometimes patients say during it, like, what the heck is this guy doing? But we'll wrap it up at the end, and then we'll explain it all in detail at your report of findings. So we're going to be checking brain lobes. So all chiropractors are trained to find nerve interference in the spine, but we are additionally trained to find nerve interference in the brain. So the first thing I'm going to be looking at is your posture, but not from a spinal perspective, just one shoulder's high and so you need something adjusted here or there in your spine, but from a brain perspective. So I'll be looking at your posture. If we see one shoulder rolled in and that same toe out, and then we find weak muscles on that same side, we know that that right side of your brain is not engaging like it should, and that has major consequences for our health, not only in terms of muscle firing, muscle fatigue, but also in terms of breakdown on that side of the body, because your sympathetic nervous system, that fight or flight system, is engaged, which is going to shut down the vascular supply and cause you great difficulty, and may even cause problems such as an imbalance in blood pressure side to side and much, much more. So this right-left brain balance is a big deal, and if one side is off, that's also going to affect the immune system, how it communicates, whether it's able to start an immune response adequately or shut down an immune response like it should, and it's going to affect things like depression or anxiety depending on which side shows up. So know that that's a big deal. Next, we will be doing some tests for specific brain lobes. I'll be taking a lighted pen, moving it in different directions, seeing how your nervous system reacts with a muscle test. This time we're talking about muscle testing in terms of reflex responses that simply tell us about change in your nervous system. And when we get change with different motions that you do, different positions of your eyes, and so on, then we know that that's a clue that those areas of your brain are stressed. And then we can devise a program to help you in terms of those areas of the brain get stronger and healthier. We also want to look at something called central integration. And central integration is the ability of our brain to control the muscles in the center of our body. And we'll find muscles that are strong equally side to side, but test them at the same time. And if you lose strength, that's a difficulty with central integration, and it usually means problems in the center part of your body, like reflux disease with your gut, like bladder problems, like low back problems. Next, in some cases, we'll recommend an EEG. And if you have depression or anxiety or issues like that, or ADHD, for example, then you want to ask my staff to get this EEG exam up front. That's a measurement of the brainwave activity. It's totally painless. It takes about 45 minutes, and we've got a very precise way to use that to help you overcome things like depression, anxiety, or ADHD. Now, we'll also be checking specific nerve to muscle connections, like we might check your biceps and your triceps and your wrist flexion and extension, because we want to know which nerve circuits in your neck or your lower back are turned off. Then we'll be checking cranial nerves, and those are nerves in the face that control things like smiling and puckering your lips and moving your tongue and hearing, and activating your vagus nerve, which helps you vocalize but also helps with rest, digest, and repair. So we'll be testing all those nerves. In addition to that, we'll be looking at different reflex points on the body that give us clues about hormonal balance, about immune strength, and detoxification efficiency. And those are part of our hidden model that we've discussed previously. So we'll get all that information for you. I'll try to wrap up the basics of that at the end of your first visit, and then the details of it and the recommended care plan will be covered at your reported findings visit. And so that'll be a second visit. It's included in what you pay for the first visit. And during that visit, we will answer the questions of what's going on, can we help, how long it'll take, and how much it'll cost. You definitely want anybody that's a support person for you, your spouse, or if it's a child, we want both parents there at the report of findings. And if they can come to the exam also, that's great, because more eyes to see what's going on. So many of the things I test neurologically can be seen visually, and you'll see exactly what's going on. So it's helpful if they can be there for the first visit also, but definitely for the second visit, for the report of findings, when we discuss all that information. So I look forward to helping you regain your health and be as healthy as possible. I've been in practice now 35 years. I have thousands of hours of continuing education. We have a trademark on our United States trademark on our process. And I've seen people that have came to Paducah to our office exclusively, no other reason to come to Paducah, from nearly 20 states now. And so we're not messing around. We're ready to help you get healthy. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.